I am Dr. K.D. Tripathi, working at Prayagraj, Allahabad, the consultant of different hospitals, particularly Guru Kripa Jagrati Hospital, Madnani Hospital, and a lot of other multi-specialty hospital. And I have my own outdoor clinics at the Lukarganj, Prayagraj. And I am basically the sports injury surgeon, the arthroplasty surgeon, and my other interests are the complex trauma and the difficult trauma. What we are aiming is the musculoskeletal health plays a key role to keep good mobility and dexterity in an individual, along with enhancing their ability to work and actively participate in all aspects of life. Particularly, the good musculoskeletal health is also crucial to maintain the economic, social, and functional independence across their life course. Basically, what happens? Our muscles and bones and joints, particularly, they are the second heart of our body. Particularly, the limbs, the muscles of lower limbs are the second heart of our body. If they are not functioning well, our heart, our lung, they cannot function well. So, to work this physical activity, they have a very crucial role reducing into the risk of non-communicable disease, and it can only achieved by the adequate musculoskeletal health. The other way around, if you have good heart and lung capacity, you can very well supplement the musculoskeletal health, and both are the complementary of each other. A strong relationship between the painful musculoskeletal conditions like lack of physical activity and resulting functional decline, frailty, loss of well-being, and loss of independence, as well as the depressive symptoms, has been described by the several epidemiologic studies. An individual with arthritis and musculoskeletal disorders is sure to be lesser active than the individual without arthritis. Thus, a lack of regular physical activity emerges as the most prevalent risk factor associated with the functional decline. Most importantly, impaired musculoskeletal health causing reduced physical capability like grip strength, walking, speed, chair rising, and standing balance has been frequently linked to the increased mortality. Thus, the weak musculoskeletal health is the key to component frailty. What is the impact of impaired musculoskeletal health? Impaired musculoskeletal health is now recognized globally with an increase in the morbidity and mortality related to it. If you have good exercises of the musculoskeletal system like jogging, running, cycling, and swimming, I think it increases the lifespan of about 5 to 7 years. Good musculoskeletal health is crucial for maintaining an active, productive, and prolonged working life. With an increase in the global retirement age, maintaining good musculoskeletal health will become increasingly important for older workers as many occupations and work-related activities are associated with musculoskeletal disorders like low back pain, the shoulder disorders, the cervical pain, and the osteoarthritis of the knee, the painful knee and shoulder. Thus, it is important to identify and implement effective interventions for the people of musculoskeletal conditions to remain productive at work. The high-income countries observe musculoskeletal conditions to be one of the major cause of work loss. Early retirement and lost retirement wealth, while developing countries see musculoskeletal conditions to have a major impact on the livelihood. Thus, the reduced musculoskeletal health result in the reduced productivity and economic loss to the society at all levels. So, the message is that keep on regular exercises, maintain your musculoskeletal system like joints, muscles, and bones. They keep you healthy, keep you mobile, and keep your all the other organs like lung, heart, and brain to be as competent as. What is the burden of disease related to musculoskeletal conditions? The non-communicable diseases now account for the most of global burden of the disease, with musculoskeletal conditions being the leading contributor. Developed countries well recognize the transition of burden to long-term disabilities condition. However, now low and middle income countries are also demonstrating the enormous future impact from the musculoskeletal conditions such as osteoporosis, low back pain, driven by population growth and aging. Since the age is commonest risk factor for the musculoskeletal condition, it is estimated that by 2050, there will be 5 times rise in the population over 40 years living in the developing countries, contrasting the wealthier countries, the World Bank data 2011. Additionally, obesity, other important risk factor for many musculoskeletal conditions, is also hypothesized to rise dramatically in developing world over the coming 2 decades. Furthermore, increased use of motor vehicles is not only reducing the physical activity but also increasing the numbers of motor vehicle accidents and resulting the burden on musculoskeletal disorders and trauma. I think the sedentary lifestyle is one of the most unwanted things for the obesity, for the dysfunction syndrome, and basically video games, social media, movie streaming, and watching everything is they are contributor to the obesity and sedentary lifestyle. This surge in sedentary behavior is not only the major risk factor for many chronic diseases, but it is also recognized as a substantial global economic burden. Increasing physical activity and optimizing exercise as recommended by Arthritis Research UK versus Arthritis and World Health Organization is an optimal way to improve the musculoskeletal health. Evidence shows that effect of sedentary lifestyle, e.g. desk job, can be reduced by a small amount of activity every day. A recent meta-analysis utilizing the data of 1 million individuals concluded that 1 hour of moderate level activity daily can eliminate the increased risk of death associated with 8 hours of sitting. Thus, a moderate level of physical activity remains a key requirement for healthy aging and maintaining musculoskeletal health. Sedentary behavior is a major contributor to obesity and type 2 diabetes. Likewise, obesity is also a major contributor to the development of progression and of osteoarthritis, and several epidemiological studies confirming the link between adiposity and joint degeneration. Evidence suggests that increasing the level of physical activity will not only increase the musculoskeletal health, but also decrease the risk of suffering from obesity-related diseases such as diabetes, hypertension, and cardiovascular disease. What are the recommendations of physical activity? Basically, half an hour a day, at least nearly 2 hours per week, or moderate physical activity, or about 20 minutes a day of any kind of physical activity like brisk walking, jogging, and running, cycling, swimming is recommended by WHO. The advantages of running or cycling or swimming is far more superior, and in all the exercises, running is one of the best exercise which elevates the heart rate, which makes your heart quite compatible with the majority of stresses, and basically it provides the good ventilation to the lung, and basically the muscles of the lower limb, the joints of the lower limb, spine, the core muscles, they all are benefited by the half an hour of running, and it improves the longevity and better health procedures of the patient. Apart from rendering musculoskeletal health benefits, the improvements in cardiorespiratory fitness can be achieved by changing sedentary behavior to achieve a low intensity physical activity like walking. Exercise is now widely prescribed for the rehabilitation of musculoskeletal injuries, and its use as a preventive health measure is now widely investigated, and guidelines around the type, frequency, and duration of the activity being considered. Evidence shows that low back pain, neck pain can be benefited by staying active and exercising regularly. Group exercise programs of weight loss support, if required, can be considered to reduce the incidence of falls, balance, and strength training, home hazard assessment, participation in falls prevention programs, and getting involved in the activities like gardening, dancing, etc. helps a lot for these kind of problems. Osteoarthritis has been shown to be benefited from activities and exercises that improve muscles, aerobic fitness like walking, swimming, pilates, and weight loss support can be rendered if required. Aging is inescapable. Everyone has to it, but it can be made easy and healthy with the help of exercise. Exercise renders many benefits to the aging body, including reducing the manifestation of aging, especially the aging phenotype of the elderly. A recent systemic review concluded physical exercise renders a positive impact on muscle mass and function healthy subjects aged 60 or above by improving muscle performance by increasing ratio type 1 to type 2 muscle fibers and increasing the cross-sectional area of type 2 muscle fibers. European Society for Clinical and Economic Aspects of Osteoporosis, Osteoarthritis and Musculoskeletal Diseases Task Force recommended higher protein intake in combination with the physical exercise in postmenopausal women at risk of developing menopause-associated musculoskeletal disease like osteoporosis. Physical exercise program improve strength and balance in the aging women with osteoporosis. Additionally, fragility fracture risk associated with osteoporosis can be decreased by following an exercise program. And exercise increases bone density and reduces inflammatory markers. Thus, having an active lifestyle from an early age, the following recommendations for exercise could be benefited for women. Furthermore, exercise and mechanical loading is also have a positive impact on the molecular, cellular, and tissue levels. Like with aging, the potential for cell proliferation and number of stem progenitor cells like decrease in tendons. Exercise loading can induce an tendon collagen synthesis, thus increasing tendon strength. Physical exercise and mechanical loading also have a positive role on the maintaining cartilage and bone health. Moderate exercise could also enhance the quality of tissue produced during the healing of injured tendons. So I can give an example like running and cycling. It provides basically the happiness, the positivity, and basically the increases the circulation of body. It can glow your skin. It can provide a good vascularity to the brain, to each and every organ of the body, and thus it can increase the gives all around circulation of the body and this gives the longevity and provides inhibits the negativity of your day to day. So most of the psychiatrists, most of the persons, they recommend that half an hour of good moderate exercise can just prevent you from the depression and other psychological disorders. So what are the consequences of childhood obesity and physical inactivity? Lack of physical exercise in childhood causes childhood obesity. Like our children are basically now because of video games, because of these digital media, they are mostly on the mobiles and computers, and they have most of them, they take the fast food. So I think the combination of lack of exercise and good amount of eating, these patients, they have obesity and other problems in this thing. And the healthy diet, is the diet also part of healthy living? Yes. How does it affect the musculoskeletal health? Diet is inevitably an important part of healthy living. A 3-year follow-up study, including about 400 adults, showed that diets high in potassium, basically fruits and vegetables, reduced to the amount of muscle loss in adults more than 65 years. Dietary flavonoid intake from the fruits and vegetables is also known to be positively correlated with the good bone health, bone mineral density, and bone resorption in the perimenopausal women. Improving the diet in osteoarthritic patients have shown great benefits. Vitamin D, calcium, and particularly protein consumption have been shown to be optimize muscle, bone, and functional outcome in the older people, reducing fall and fractures. Calcium and protein synergistically optimize bone health. The dietary strategies for improving musculoskeletal health should include consumption of long chain fatty acids, vitamin D, vitamin K, and they decrease blood cholesterol. Antioxidant-rich diet may benefit athletes by improving their tissue repair. The sarcopenia in elderly people can be benefited by combining exercise with dietary supplement of the whey protein fortified with vitamin D and increased muscle mass and strength. Thus, I think in conclusion, what we can say that if you have good amount of moderate exercise up to half an hour to 1 hour a day with the diet rich in protein, calcium, and minerals and vitamins, along with the good sleep of about 6 to 8 hours in the night, can keep your musculoskeletal system, musculoskeletal bones and joints and ligaments. They all can be healthy, and these good musculoskeletal health can supplement your cardiovascular system, your brain, your kidney, your lung, your skin, and every other organ gets good vascularity and good ending because of all these combination of good sleep, good healthy diet, and good exercises. Thank you. Thanks a lot for your patient hearing.